Welcome back to Nursing Education. Today we're going to look at one of the most important topics, I believe, in nursing and in nursing practice, whether it's theoretical or when you're actually, doing your work in the world. And that topic is critical thinking. So I'm going to read from the textbook first and then provide some of my personal experience and some comments about this topic. So critical thinking defined. Thinking and learning are interrelated, lifelong processes. As a person selects a career path, it is important for that individual to become more aware and skilled in thinking. Over time, the knowledge and practical experiences gained help individuals to broaden their ability to make thoughtful observations and judgments, and I don't think that's relegated to nursing alone. I think this applies to all professions. So critical thinking is the active, organized, cognitive processes used to carefully examine one's thinking and the thinking of others. So it's not restricted to just ourselves, the individual, but even people around us. It involves use of the mind in forming conclusions, making decisions, drawing inferences, and reflecting. It means taking nothing for granted. A critical thinker identifies and challenges assumptions, considers what is important in a situation, imagines and explores alternatives, applies reason and logic, and thus makes informed decisions. So another way to express this is thinking outside of the box. It's not only relying on the status quo, but you're actually looking at, again, outside of the box, and you're making informed decisions. So this relates very much to informed consent, somebody who's really educated about the situation and their options. For a new student nurse, critical thinking begins when the student seriously questions and, in a continuing way, tries to answer again and again, what do I really know about this nursing care situation? How do I know it? For example, what do I really know about caring for a senior? And how do I know this? How do I know this knowledge? How do I know how to do this? What do I really know about Mr. Smith's pain, and how do I know it? Critical thinking presupposes a certain basic level of intellectual humility, for example, acknowledging your own ignorance, and a commitment to think clearly, precisely, and accurately, and to act on the basis of genuine knowledge. When the nurse directs critical thinking toward understanding and assisting clients in finding solutions to their health problems, then the process becomes purposeful and goal-oriented. So one thing that stands out to me in this paragraph is the difference between a registered nurse and a registered practical nurse. So what a lot of people will say is that RPNs, registered practical nurses, know how to do nursing, they know how to do certain procedures, but they don't know why they're doing them. They don't know the rationale behind their actions. And for registered nurses, that is the distinction. They know the why. They know how it connects to everything else. So I find this interesting that a nurse must, or is encouraged to at least, use their critical thinking in order to understand the people they are treating, their clients. Use their critical thinking in a way that serves the client better. Again, using an approach towards greater understanding. So you're putting yourselves in their shoes, and using critical thinking to assist them, to assist your client. So helping to understand them, but also helping them just as a person, as a human being. So doing this, again, makes the process purposeful and goal-oriented. So the APA, the American Philosophical Association, I suppose that's different than the Psychological Association, has recognized critical thinking to be purposeful and self-regulatory judgment that results in interpretation, analysis, evaluation, and inference. Through critical thinking, a person addresses problems, considers choices, and chooses an appropriate course of action. So one thing that stuck with me since I graduated was a critical thinker doesn't just look at one solution, one potential solution. They look at all potential avenues. So to look at all potential choices that can be taken in terms of treating a person. And even before you treat them, you look at all potential avenues as to what is this situation? What is the diagnosis? What am I dealing with here? And then you pick the best one based on the supporting evidence, not based on your instinct, but although that does play a factor in some cases, based on experience and so on. So you want to be able to reconsider and think clearly about issues. So the APA identified core critical thinking skills that when you apply them to nursing, they're useful in showing the complex nature of clinical decision making. Being able to apply all of these skills takes experience and thoughtful consideration of the knowledge that you gain in the clinical care of clients. So it is described by these authors, elements that increase the tendency to think critically in an ideal critical thinker. There are various attributes that they would have. The nurse who is a good critical thinker faces problems without forming a quick, single solution, like I mentioned, and instead is focused on the options for what to believe and do. So you look at all possible options and you pick the best one, not for you, but for the client. This requires discipline to avoid premature decision making. Learning to think critically helps a nurse care for clients as their advocate and to make better informed choices about their care. So you're helping the client to make better informed choices. Critical thinking is more than just solving problems. Instead, it is an attempt to continually improve. The nurse learns to focus on problem prevention as well as maximizing a client's potential. So again, focusing on optimal health, being the best they could be, having the best health they can possibly have. A critical thinker learns from each clinical experience and pursues each new opportunity with an openness and renewed purpose to excel in practice. So as much as it is about focusing on the client and encouraging them and doing what's best for them from their perspective, you're also focusing, as a nurse, you're focusing on being open-minded, not closed-minded. You're also thinking about how sometimes it's best to be patient when you're proceeding with a treatment. And as well, they close here saying a renewed purpose to excel in practice, which can be related to continuing your education or simply improving on perhaps mistakes you've made or deficiencies in your nursing practice. So that's all for this video. That's critical thinking. It's kind of in a nutshell, but that's the important aspects of it. And one thing I just want to reiterate is critical thinking is thinking outside of the box. You're not just going to accept whatever people are saying is the truth or what science deems as this is the only way and there's no way out of it. For example, we look at cancer treatments and a lot of doctors and specialists will say this is an impossible situation. There's no cure. There's nothing that can be done. A critical thinker will say no, that's not true. You have to think outside of the box. There are ways, maybe not to cure cancer, but to improve the person, the individual's health status. And I also want to reiterate that critical thinking is very much not just looking at one avenue, it's looking at multiple avenues. And after carefully analyzing and weighing the pros and cons of each, you pick the best one, not for yourself, but the client, and which action, which methodology is the most realistic and pragmatic. So thank you again. Please like and subscribe this video. more videos to come.